It's estimated 7 million Americans are living with dementia. The disease made headlines recently because of actor Bruce Willis's diagnosis. Dr. Kumar is on call this morning with more about this devastating condition, which can impact the entire family. Good morning, Dr. Kumar. Thanks so much for being with us this morning. We really appreciate it. First of all, tell us what is dementia and what are the major different types?
Sure. So dementia is a disease that results in an impairment of memory, thought, or decision making, and it's caused by an accumulation of abnormal proteins within the brain or reduced blood flow to the brain. It is not a part of normal aging. Now, the most common cause of dementia is Alzheimer's disease. It accounts for about 60 to 80% of cases, and the hallmark symptom here is forgetting recent events, like a conversation that maybe happened minutes or hours before. Then vascular dementia makes up about 10% of cases. That's linked to strokes, diabetes, hypertension, and then finally frontotemporal dementia. This leads to personality changes, behavioral changes based on the parts of the brain that are being affected.
What puts someone at risk to develop dementia?
So genetics definitely play a role. Having a first-degree relative with Alzheimer's disease increases your risk of developing it anywhere from 10 to 30%. But environment and lifestyle play an even bigger hand in this. You see, dementia disproportionately affects the Western world. There are significantly lower cases in India, Asia, Africa. It's almost non-existent in the Amazon. And they attribute this to the fact that we have a greater exposure to obesity, smoking, and diet, which plays a huge role. A lot of ultra-processed foods and high-sugar foods in our diets, and then a higher prevalence of vascular disease, hypertension, and diabetes in the Western world.
So let's talk about how dementia is treated.
So unfortunately, we do not have a cure for this disease. There are some medications that can help with symptoms. Earlier this year, a new drug was released, accelerated FDA approval for a monoclonal antibody that can actually slow progression of disease about 27%. Again, it's not a cure. So it's really about management with a focus on patients' strengths. So when you have dementia, patients that have dementia, they have a lot of cognitive decline, but there are also parts of their brain that are retained, like intuitive thought, an appreciation of art, nature, creativity, even some of their hobbies, and we take a lot of these things away from these patients. So it's important to keep that in mind if you're caring for a family member with dementia. Like, let's say your family member was an avid golfer, maybe set up a little putting green in the backyard, or if they like to cook, involve them somehow in the preparation of family meals, because dignity and quality of life are the most important things with these patients.
So if there's no cure, prevention is the key, and how can we approach that?
Okay, well, the largest study looking at modifiable risk factors for preventing dementia came out of Finland, and they found a 40% increase in memory, 83% increase in cognitive function, meaning focus, attention, being able to follow instructions with some simple lifestyle modifications. Diet. Increasing your intake of fruits, vegetables, lean proteins, low sugar, low alcohol. Exercise, cardio, but strength training was equally as important. Actually, lifting weights actually strengthens a part of your brain related to memory, your hippocampus. Challenging your brain, social interaction, and then finally super tight control of those risk factors, keeping blood pressure down, blood sugar down, and blood cholesterol down.
All right, Dr. Kumar, thank you so much for talking with us today. So insightful. We really appreciate it.